All right, Jessica, thanks so much for doing this. My first question that I have for you is, just tell the audience a little bit about yourself and how you started, in the mental health field and kind of just like your journey.
Yeah, absolutely. So I'm Jessica. I'm a licensed clinical psychologist. I currently live in South Carolina and I work at a children's hospital here. So I guess my journey to getting in the mental health field, personal journey, I was in therapy as a teenager, but never really wanted to go into mental health until when I was a freshman in college. My cousin died by suicide, and
Mhm.
I started volunteering for a nonprofit, Mental Health America, and ultimately decided to shift what I wanted to do with my career. So I became a psychology major, went on to get my master's in clinical psychology, then went on to get a doctorate in clinical psychology. And initially, I thought I wanted to do mostly research. But when you're in a graduate program, you have to do clinical work. And I took a rotation doing clinical work with children because really nobody else in my program wanted to do it. So I was like, sure, I don't plan on doing clinical work anyways. And I fell in love with it. And so now I work in Children's Hospital, like I said, and I work half-time medical inpatient, so working with children and adolescents with chronic illnesses, that experience traumas, things like that. And then the other half, I'm in our adolescent medicine clinic doing more traditional outpatient. So that's just a little summary of my journey.
hmm What is it like working in both camps, both with children and adolescents?
I love it. Adolescents have a special spot in my heart. Um, if I like only could work with one age group, I would work with adolescents. Um, and with regard to being able to work both inpatient and outpatient, I love the variety that that brings. I love working with families. I personally really feel like I can make a difference when the my patients are younger versus working with adults and they might already have a lot of their beliefs or behaviors kind of set in their ways, so to speak. But with children and adolescents, I feel like I can make a much bigger impact and I can also help parents, you know, maybe learn different styles of parenting or communicating with their kids to help the parent-child relationship as well, which I love.
It's a really interesting point that you make because I was talking to a guest earlier and she talked about we were talking about psychodynamic psychotherapy and we were
Mhm.
talking about when it comes to expressing emotions, kids and particularly teens, are more open up about it, whereas kind of adults, they're more sensitive. They're not as open as people would like.
hmm Yeah, that's so true. I mean, I think of like younger kiddos I've worked with, like they're just gonna tell you how it is. There's like no filtering. They're also a lot better than adults at regulating in the sense of like they can get really, really mad. And then once they calm down, they've moved on. They're over it. And I feel like as adults, we then like kind of sit and stew in those emotions. We're like still thinking about it hours later.
Yeah. So what do you do in your current role?
So, like I said, I split my time half time outpatient, half time inpatient. So, outpatient is what you would consider more like traditional therapy. So, I have a schedule where I see clients for 50 minutes. And that population is solely adolescents. It's in our adolescent medicine clinic. And primarily, what I see there is like depression, anxiety, eating disorders, and I do a lot of LGBTQ plus healthcare. And then on the inpatient side, I see all ages. So I always say 0 to 18. I don't really work with babies, but that's the age range that we see in the hospital. And there I do a consultative role. So basically, a child is admitted to the hospital, and if the medical team feels like they would benefit from psychology support, I would get a consult, and that would look like going into the room, kind of evaluating, what's going on. So a lot of times it might be this individual just got a new diagnosis of a chronic illness, and we want you to see how they're coping with it, if you can provide any psychosocial support. It could be a trauma like a car accident, gunshot wound, dog bite, and doing more acute trauma therapy. I see a lot of eating disorders in the hospital as well. It could even be something like this kid has been hospitalized for 2 weeks and they're tired of being here? Can you go talk to them about maybe some coping skills to help them get through this hospitalization? So there's a lot of variability. One thing I love about working for a hospital system is the interdisciplinary team approach. So I get to work with doctors, nurses, social work, physical therapists, occupational therapists, dietitians, and I really love that team-based approach because I feel like it really helps our patients get wraparound care.
Mm-hmm. How's that different from like if someone does like a private practice? How are those two areas different?
So I have never worked in private practice, but most private practices are just therapists themselves. Some I do know of might have like a dietitian or a psychiatrist on staff. So even, I guess, even though I work for a hospital system and my clinic is based in the hospital system, I can even talk about the differences there. I do have physicians, nurses, a dietitian in our clinic, but it's not as integrated in the sense of like I kind of have my own patients. I do share some of the patients, but it's not as collaborative in many senses as working together as a team. But in private practice, most often it's just the therapist. And so if your client has a psychiatrist or a dietitian or a primary care doctor, usually like you can communicate with them if the person signs a release of information, but it's not as connected. It's more disjointed in many ways. Like we can definitely make it collaborative, but since I work with these people day in, day out, like I can just walk to their office and check in, or in the hospital, just like catch them on the floor while they're doing their rounds versus having to like set up a time to have a phone call, things like that.
Yeah. So what sorts of modalities do you use in your particular role?
Yeah, this is a great question. So I was trained heavily CBT, so cognitive behavioral therapy, and I still do use CBT a lot. However, working with medical trauma, complex medical illnesses, I have found through my work that's not always the best approach for some of my clients because the maladaptive thoughts that they're having are based in reality. Because, like, it does suck, can I say that on the podcast? Getting a life-changing medical illness. So I also use a lot of ACT, so acceptance and commitment therapy, really focusing on values work, acceptance of thoughts, situations, how can I still live a value aligned life despite my chronic illness or despite this new trauma or my new onset paraplegia. And then I also bring in other like skills like DBT skills. I'm not formally DBT trained or dialectical behavioral therapy, but I find that's really helpful for a lot of my adolescents, regardless of what they're presenting with, but especially like my eating disorder patients. I use some exposure with response prevention for my patients that present with OCD. So all are still within that cognitive behavioral realm. But depending on my client, their presenting problem, I take more of an eclectic approach. Like if I think a skill from DBT is going to be helpful, I'll use it. If I think a skill from ACT is going to be helpful, I'll use it and kind of let the client and what works for them guide the modality I use.
What has been your favorite modality that you've used?
So I love the values work portion of ACT. So ACT uh, has a number of different pillars, so acceptance and commitment therapy, but one of the pillars is values work. And I love this so much because I think all of us can benefit for kind of really reflecting and doing exercises on what are our values, what is most important to us in life. For my chronically ill patients, I think it has been abundantly important for them to really reflect on what gives them their life meaning, what do they value, and how can they still live a life that aligns with those values despite whatever new diagnosis they have gotten. So I do a lot of values work and then we set goals based on those values, kind of looking at what has to change about your life because of this new diagnosis, what can stay the same, how can we make tweaks and adjustments. And I just think values work is something I do in my own life as well because it's it seems very simple in many ways, like reflecting on your values, trying to set goals along with that. But if you ever reflect on times that you're uncomfortable, you feel like life's not going really well, and then you check in with your values, you often can see like, hey, I value like maybe family but I haven't had time to spend time with my family in months. That's probably why I feel distance or detached. Or if you value like creativity, but you've been so bogged down with work or other responsibilities, you haven't had time to have a creative outlet, it makes sense that you're not feeling great. And then you can kind of figure out tasks to do that align with your values to live a value driven life. So that is probably one of my favorite aspects of a certain modality.
Mm-hmm. And now getting back to like because a couple days ago, I think it was I saw your Instagram handle, and it had some interesting content. Like, what sorts of stuff do you post on there? Do you post like medical, not medical, but um like psychological, like tips, advice,
Mhm.
what's on there?
A lot is on there and it has changed over the years. So, yes, I have an Instagram dedicated to just providing mental health content. It was something I started during the pandemic and have just continued to go. So when I first started it, it was a lot focused on the areas that I practice in. So I do a lot of, you know, the intersection between medical illness, mental health, eating disorder content, LGBTQ plus content, anxiety, depression. So some of that is just general information, tips, things like that. In more recent years, I do post a lot of mental health related content that is current to the socio-political climate. So like recently I've been posting a lot about autism. One thing I guess I didn't say earlier when talking about my training, I did my fellowship in developmental pediatrics. So I did after I got my doctorate, a year of postdoctorate training in like autism and neurodevelopmental disorders. And so, given the recent socio-political climate and a lot of conversation about autism, I've been posting a lot of stuff on that. I post a lot about like suicide and suicide resources, since that's what got me first into this field in general. Sometimes I'll just post themes of like, I don't post anything directly related to clients that's unethical. But if I'm noticing like, okay, a lot of my clients have been talking about boundary setting or talking about communication difficulties, I might make posts on that because I'm like, if a bunch of my clients are bringing this up, other people are thinking of it. So I would say my content is pretty eclectic across the spectrum of things that either I work with day in and day out or just other things I'm really passionate about that are relevant to other conversations going on in the media or elsewhere.
Mm-hmm. Because that was my next question. Like, what's the purpose of posting content like this? What's your goal?
Yeah, that's a great question. Because honestly, my goals have changed over time. So when I first started it in during the pandemic, it was people mental health was struggling and not a lot of people could access therapy. So it was, can I get some mental health content out there, maybe some tips, tricks to help people that can't access therapy. Then over the years, it's kind of evolved into more, I enjoy doing it. And if somebody comes across my content and they find it's informational or helpful, I'm a big research nerd. I love research. And so I'll post a lot of like evidence-based or like summaries of articles that have recently come out. And, at this point, I just do it because I enjoy it. There was a time I felt like forced to post. Now I just post kind of what's on my mind in the hopes that if somebody doesn't have access to therapy, or if somebody is looking for evidence-based information, or maybe even a simplified breakdown of a research article, and they come across my content and find it helpful, that's really what I'm doing it for. It also just gives me a hobby to do, honestly, outside of everything else I do in my
Mm-hmm.
life.
Yeah. So what's one thing that I've always asked mental health therapists this, what has been what's been your most favorite thing like to do in your sort of in your practice in the clinic practice realm. So what have you learned in doing this kind of work?
I've learned a lot. I guess one of my favorite things, though, is just seeing changes in my clients over time, like being able to sit with them and reflect with them on how far they have come. Um, because I can think of so many clients over the years that they're like, oh, I'm still struggling with this. And I'm like, okay, let's think back to when you first came into my office or when we first met, because sometimes I'll meet them in the hospital and then follow them outpatient. Um, and we're able to reflect on the growth and the change. As for things I've learned, I mean, I've learned a lot. A big thing I learned straight out of grad school is I didn't know nearly as much as I thought I did, because there's a very big difference between sitting in a classroom and going through, schooling versus like real life practice. Um, I've learned to set boundaries. I talk about that all the time. Being a mental health professional can be very taxing. We sit with really heavy stories of our clients and we care deeply about our clients. And so it's important to set boundaries around taking work home with you, stretching yourself thin. Um, I've also learned the importance of self-care because I can't show up for my clients if I'm not taking care of myself. And I've learned a lot from my clients over the years, whether that be, how to tweak how I approach therapy sessions based on feedback I get, or even if it's learning, like, as much as I want to help people, if somebody is either not in a space to be ready to help, or if I'm not the best fit for them, that is okay. Yeah, there's so much I've learned, but I love the work I do.
And what's on your bucket list? Like if you wanted to learn something new or if you're curious about something, what would be on your bucket list? What would be your top items?
Oh, I love this question. So I have been thinking more recently about doing more formal like trainings, possibly in modalities that I'm not as familiar with. I mentioned like ERP earlier, and I've done some training in that, but I am seeing a rise in like clients presenting with OCD symptoms. So I would love to get a more formal training on exposure with response prevention, possibly some more formal training on certain trauma therapies, whether that be EMDR or brain spotting. But I think really my goal right now is just to broaden my clinical skill set so I can better help my patients.
Mm-hmm. And the last question that I have for you is how can students, get involved into the clinical setting space of like mental health? Because it's a pretty different sort of dynamic compared to the private practice, like you just described earlier. So what
Mhm.
tips, advice would you give to those thinking about this?
Students thinking about going into the mental health space.
Yeah.
So, depending on their age, like if I'm thinking like college students, see if there are opportunities to shadow in a clinic or I know like for example, so like I said, I live in South Carolina and we have a program, it's across the US called LEN, so Leadership, Education, and Neurodevelopmental Disabilities. And one of our local colleges here um, has individuals who can, in undergrad, be part of that program. And as part of that, they can come to our hospital and shadow psychologists, medical professionals, things like that. So look for opportunities if there are shadowing or internship experiences, or even just like working at a front desk. I would also encourage people talk to different mental health professionals in the field. Our field is so diverse. Like I said, and you mentioned, like I've never worked in private practice. I have a lot of friends who have. I work in a hospital. Other people work in maybe community mental health settings. Other people do research. Um, I work with kids and adolescents. Some people only work with adults. Some people only specialize in a certain clinical presentation. So her field is so wide and varied. So I would definitely talk to as many people as you can in the field to get a sense of what they do, what you might like to do. And then if there are opportunities, like I said, to shadow or get an internship or even a job in different settings to kind of get an idea of what you want to do. Those are, yeah, the main tips I have.
Mm-hmm. All right.